Okay. Well, good afternoon.
Recording in progress.
And that does that every time. This meeting is being recorded, so just please be aware of that. And we do make these available later on for others who may not be able to join us. I'm Christy Putnam. I'm Secretary of the Arkansas Department of Human Services. We are appreciative of everyone who's in the room today. We've got a number of folks from our qualified health plans and some of our staff and other partners in the room. We've got Surgeon General Kate Chandler in the room. Dr. Kate Chandler is with us in person today. We're grateful for that. We are also very glad to have a number of new members joining us for the first time. So welcome to all of you who have not yet participated in one of our ARHOME Health and Economic Outcomes Oversight Advisory Boards. We have these meetings quarterly. And this meeting is really going to focus on giving an overview of what ARHOME is, what it does. We are required to take attendance of advisory panel members, and so we're making sure that we get that recorded and have your name down so that you have attended. We provide that response to our legislative partners. Arkansas PBS is live streaming this meeting, so you can watch it now or watch the recording later, as I noted. And again, we're just really excited to get into the information. It's a really good reminder and recap for those of us who maybe haven't revisited what ARHOME is and what it's all about, what's included in it. And then for those of you, like I said, who are new advisory board members, welcome. We look forward to getting to know you a little bit better. And we also look forward to your thoughtful questions. People ask a lot of really good questions during these. So with that, unless
I would say that they are fixing it, but right now it is set up as a webinar on our meetings.
Okay, so that makes a lot of sense. Right now we have the wrong format. We're set up in a webinar format, which is why you were not able to talk. So we're going to work on that and fix it. While we are working on that, I will go ahead and welcome our new members, and then I want to acknowledge our returning members as well. So for new members, we have Senator Blake Johnson, Senator Jamie Scott, Representative Keith Brooks, Representative Lee Johnson, Representative John Maddox, Representative Stephen McGee, Representative Jeff Wardlaw, Secretary Lindsay Wallace with Department of Corrections, and Ms. Lauren Fields. And I believe Ms. Fields is on her way to be in person. Returning members, we're grateful for you all signing up to serve another term. We have Dr. Kate Chandler, we have Senator Missy Urban, Senator Jane English, Secretary Jim Hudson, Secretary Renee Mallory, Secretary Alan McLean, Dr. Sharice Childers, Ms. Jerry Clark, and Ms. Kenya Eddings. Thank you all for participating and for continuing to provide good input on how ARHOME is serving our Kansans through coverage and through services. So I think with that, make sure that I am not missing anything. I think what I'm going to do is turn it over to Jennifer Dedden for the ARHOME overview. And while we're doing this, hopefully the webinar format gets fixed and we're able to take questions as we go through. But if all else fails, if you have my number, you can text me and we can certainly ask your questions while we go through the overview. So Jennifer, thank you so much.
Thank you. I will say, if you haven't already, if you're attending online, would you please post your name in the chat and who you are with your organization? We like to keep that recorded because that is something that we are required to report according to Act 276 of 2021. So please drop it in the chat for us. If you are a new member, you can expect an introductory letter from us. We're still receiving a couple more appointees, but we're going to send you an introductory letter soon, and that will have all kinds of good information about ARHOME in it. The report, the quarterly report, is already available online. You can see here are a couple of links. You can stream the meeting later. You can look at the quarterly report at that link there. And oh goodness, I'm being informed that the chat is disabled and you can't drop your names in yet. So when you can, if you would please.
I think they're also planning to take a screenshot as well.
Oh great, that'll help. Thanks for bearing with us. Okay, so this is what ARHOME is. We are the Arkansas Health and Opportunity for Need program, which was created by Act 530 of 2021. It's what's called the Section 1115 Waiver Demonstration Program. Section 1115 is a section of the Social Security Act. And what it does is it allows states to test new or innovative ways of delivering their services by giving us flexibility from certain federal requirements. If you like to look at statutes like I do, The ARHOME governing statutes are in Arkansas Code annotated section 23-61-1001 at SAC. Arkansas's Affordable Care Act expansion is accomplished through ARHOME. So that's what our program does federally. ARHOME uses Medicaid funds to buy insurance for eligible participants from qualified health providers on the health insurance marketplace. And the share there is the federal government pays 90% of the cost and the state pays the remaining 10%. Our QHPs are currently through Centene and Arkansas Blue Cross and Blue Shield, and you can see the breakdown of our QHPs there. To be eligible for ARHOME, applicants have to be an adult between the ages of 19 and 64 and below 138% of the federal poverty level. There's our dollars for a household of one and a household of three for 2025. Currently, we cover about 230,000 beneficiaries. Upon enrollment, they're placed into two categories, either medically frail is an option that you can choose, or awaiting QHP enrollment. And that places you in an interim alternative benefit plan until you are placed in QHP. Medically frail beneficiaries have healthcare needs that are better served by traditional Medicaid. They do not enroll in QHP, and instead they receive healthcare services through traditional fee-for-service Medicaid. That's about 6% of ARHOME beneficiaries. Individuals who are not medically frail begin the process of enrolling in a QHP. They have 42 days to select a QHP, and if they do not select the plan, they are auto-assigned to a QHP. If you are auto-assigned to a QHP, you've got another 30 days to change your plan before your QHP coverage begins. Most ARHOME beneficiaries are enrolled in QHP, as we can see here. That blue block is those who are enrolled in a QHP. That orange block is awaiting QHP enrollment. That's a rolling number of courses people roll into a QHP. And that little gray section at the top is our medically frail population. Here's how that QHP enrollment breaks down. You can see it by plan. All of the Blue Cross plans are blue and all of the Centene plans are green. This is our last 4 quarters, so we're looking back all the way to quarter 3 of 2024 here. For ARHOME beneficiaries, DHS purchases the lowest cost qualifying silver level plan that's offered in every rating area, and those within 10% of the lowest cost plan. The plans that we purchase are available to the public on the Arkansas Health Insurance Marketplace, and they cover all 10 essential health benefits that all marketplace plans are required to cover under the Affordable Care Act. We've got a list of those here. You can see that it includes ambulatory services, emergency services, pregnancy, mental health, prescriptions, and more. ARHOME clients do not pay premiums, but they do pay co-payments. Co-payments for clients that are below 20% of the federal poverty limit pay $0 for all covered services. If a client is between 20% and 138% of the SPL, the co-payments range between $0 and $9.40 for covered services, but most services are at about $4.70. Again, our costs are split 90-10 with the federal government. The state share is 10%. Our total program expenditures for 2024 were $1.8 billion. ARHOME is required to stay underneath a budget neutrality cap each year. What that means is that it cannot be more expensive to run this through this waiver program than it would be without the waiver program. Our budget neutrality cap for 2025 is $849.43 per member per month. And for Q1 2025, ARHOME was well below its budget neutrality cap at $802.20 per member. Maternal Life 360 is a program that falls within ARHOME. Let me give you a quick overview. DHS contracts with hospitals to provide home visiting services to high-risk pregnant individuals that are enrolled in the program. All medical services continue through their QHP or through traditional Medicaid. DHS has approved or executed a total of 10 letters of intent from hospitals. 2 were withdrawn. We had 5 applications, one is still under review, and 4 provider agreements for hospitals to enroll up to 245 beneficiaries collectively, and those are at White River Health, St. Bernard Medical Center in Jonesboro, Baptist Little Rock, and Baptist Rock. Okay, I'm turning to new legislation. Act 774 of 2025 was signed into law on April 17th. It amended ARHOME's governing statutes, which I mentioned earlier. They added language concerning work requirements, pharmacy rebates, and a medical loss ratio of 85%. The act also extended ARHOME's sunset statute, allowing the program to continue until December 31st, 2031, or a later date if extended. And we are working currently to renew our waiver with CMS for an additional 5-year period. That should happen. I have a slide on that in a moment, but that should happen this year before the end of the year. Pharmacy rebates are discounts, incentives, or other payments that drug manufacturers pay and remit to insurers based on the drug's utilization. Act 774 requires ARHOME's QHPs to seek all available pharmacy rebates for products that they cover and remit the funding to DHS. DHS isn't required in turn to track the rebates and ensure that the amount of the pharmacy rebates is remitted to the state each quarter. Act 774 also includes a statement of legislative intent that recognizes that pharmacy rebates are an important tool for ensuring access to and affordability of pharmaceuticals, and an instrument for ensuring the fiscal sustainability of the ARHOME program. The medical loss ratio is the percentage of premium dollars that a health plan spends on its medical claims and quality improvements. The Affordable Care Act sets a minimum MLR standard for health insurance. Act 774 requires QHPs to maintain an MLR of 85%, which is up from 80% before the act, or rebate the difference between the insurer's actual MLR and the 85% to be returned to DHS for its ARHOME members. And finally, Act 774 does add a requirement that ARHOME clients comply with all state and federal Medicaid program work requirements and sets criteria for individuals meeting the work requirements. DHS has proposed a work requirement program, which is known as Pathway to Prosperity, that is under review by CMS and is going to be discussed in full in just a moment. The federal work requirements are being established in pending legislation. I do want to note that our Pathway to Prosperity, Act 774, and the federal requirements are not in conflict. These are all things that can work together. If the federal requirement should set a floor, and then what we are doing is above and beyond that floor.
I was gonna say, is there?
Oh, sorry. No, the chat should be working now for everybody.
Oh,
So
great.
if you want to enter your name into the chat, that would be wonderful so that we can make sure to track that you're here.
Yes, and if you've already emailed me, you're good, we've got you covered. So I was just going to interject on the federal work requirements piece and how that coincides with the state. We're currently in conversation, and Deputy Secretary Mann is online, and she can correct if I get something wrong, but we're anticipating conversations with CMS about how we move forward with Pathway to Prosperity and make sure that it's complementary to whatever gets passed at the federal level.
And I should also note that everyone should be able to talk now.
We're off the webinar mode. Oh, great. Excellent.
Maybe I can see it there now.
Please continue.
Okay. And moving on to Pathway to Prosperity, let's look at that a little like that. Governor Sanders announced that on January the 28th. We are currently seeking an amendment to our waiver to allow the work requirement for ARHOME beneficiaries. And the purpose is that we know that poverty is closely connected to poor health outcomes and premature death. Pathway to Prosperity will provide focused care coordination and a personal development plan that is supported by success coaching to help ARHOME beneficiaries achieve their economic independence. I will say that it has already been through a state and a federal public comment period. So where we are right now is discussions with CMS. This is moved pretty far along. The purpose is to help address the benefits cliff. The benefits cliff is, of course, the sudden and often unexpected decrease in public benefits that can occur with just a small increase in your earnings. Some individuals reduce their risk of encountering the benefits cliff by foregoing additional income or reducing their work hours. But Pathway to Prosperity will provide a bridge over the benefits cliff by increasing participants' understanding of the value of health insurance and providing supports to help maintain healthcare coverage as they move from poverty to economic independence. Here are our program goals. Goal 1 is to increase income. Goal 2 is use of healthcare coverage. Goal 3 is to increase access to private insurance coverage or maintain coverage in the most appropriate care model. And goal 4 is to address health-related social needs. Those beneficiaries who are engaged with success coaching will see improvement in their health-related social needs, including nutritional assistance, transportation, and housing. For beneficiaries who are not on track, DHS will identify a success coaching resource to make contact and determine whether the beneficiary could benefit from additional supports, or if the beneficiary is already on track. Individuals identified as not on track who decline to engage with success coaching will have their ARHOME coverage suspended. Suspended coverage can be restored if individuals re-engage with success coaching in their personal development plan. Success coaching is going to include, at a minimum, reporting in a DHS approved case management system, identifying health-related social needs and helping access to community services, development of an individualized personal development plan with identified goals and measurement of progress at 3-month intervals, tracking and documenting monthly progress, and monitoring and follow-up activities, including verifying engagement and a final determination of progress towards the goals in the personal development.
And I just want to emphasize here for just a moment that we got a lot of the questions we got, or that we've got through this process, have been about success coaches, and are those new FTEs? Are we adding, staff, that sort of thing? And I want to be very clear that success coaching is an activity and it's intended to leverage existing resources that we have out there. Examples that we've given previously include workforce development centers, where we have some case management staff with our division county offices. We have career coaches through adult education and higher education. And so really working with all of our partners who already have resources in place on the ground throughout Arkansas, and helping work toward a success coaching model where everyone can participate.
Thank you. So we have a waiver amendment that is going forward for Pathway to Prosperity, and also we're looking forward to our waiver renewal. So CMS, which is the Centers for Medicare and Medicaid Services, approved our 5-year waiver on December 21st of 2021, and so we're due for renewal at the end of this year. Our renewal waiver is going to include changes under Act 774 and the Pathway to Prosperity Initiative. Sometimes we amend a waiver between renewals, and that's what we're doing with Pathway to Prosperity. The waiver renewal will be completely separate. That's the second process. Waiver amendments have to be submitted at least 6 months before the waiver is due for renewal or set to end. We should have a more specific timeline as we move forward. Okay, so our next quarterly meeting will be held in September. I will get you a date and location as soon as we know. We'll probably look more at Maternal Life 360, and we may look at additional demographics, additional updates on our legislation and Pathway to Prosperity.
Anybody have any questions?
Everybody's gonna want her to do that.
You're gonna be great when nobody can ask me questions.
That's right. We didn't need to disable the chat. But that was a lot of information. We know that we have a lot of new members on this group. And so please, I think we can go to the screen where we can actually see people too, right? We can go back to slides. We can
Stop sharing this one. It's me.
Oh, is it you?
Right,
Sorry.
Oh, I see.
I thought it was Snell. And so if you have any questions, you can either drop them in the chat. We can certainly entertain questions live, I think, at this point with our participants. And happy to spend some time just walking through the information in case you do have questions about it.
Thank you, everyone, for signing in.
Wonderful.
I'll give you just a minute to enter some questions. Also, if you think of a question later, your meeting invitation came from me. You're welcome to email me anytime. I'd be happy to communicate with you about it.
While we wait for that, I would just like to take a point of personal privilege. This is your last meeting with us in our home advisory panel, and we have loved having you as our secretary. And you're leaving in July, so we get more time with you going back to Kentucky. We're very happy that you were with us even before you became secretary. So working on this. Yeah, this was your baby. So
Well, it was Arkansas's baby. It was definitely, I had the privilege of coming on board as a consultant in 2020 first, and then again in 2021 to help with this, and also with COVID response when we switched to that in 2020. But that is how I got introduced to the Arkansas team. And it has been, this the innovation and the creativity and the flexibility and I could use a whole lot of other adjectives for the Arkansas DHS team, but the ability to get things done and also do hard stuff, which is DHS acronym is do hard stuff, is really, or sometimes other words, but is really an incredible, just testament to the team here in Arkansas in general. Just the people have been wonderful and it's been a great experience. And I know I'm excited to see this work move on. I'm excited to see some of the changes at the federal level and what that's going to bring as far as a focus on Arkansas and the really pioneering work that has been done here. I mean, this you all were the first team, we all were the first team to get out there with work requirements back in 2018, and then bringing it back. Again, became the first to bring it back. And just briefly, and then I'll be quiet, but work requirements and community engagement have been something that I've been working on for a very long time, and that was part of the reason why I was able to come in and help here. I think it's important for people to understand that it's not intended to be a punitive anything. It's really intended to be a support and a bridge, as a really excited Pathway to Prosperity recognizes. So, great job, team. Thank you, partners, and I will be available, after the 25th.
We will be reaching out.
So, everybody knows how to reach out. So thank you all very much for all of your contributions.
Thank you.
Thank you.
I'm not quite ready to say it.
Yeah, we're only saying goodbye to this one panel meeting. We've got any more to go. That's great.
I am not seeing any questions yet, but I am sure that as you delve into materials, you will come up with questions, and if you do, I look forward to hearing from you.
Thanks, everyone.
And if there are no questions, it just means that Jennifer did a fantastic
That's
job.
right.
The team did a great job at putting together materials. I know, and no questions. So please follow up if you do have questions, but if you do not, and we're not going to belabor the point, I'll give you time back in your day, and we greatly appreciate you taking time out. And again, a special thanks to our new members for joining. Please do take a close read and let us know how we can be helpful in answering any of your questions. All right.
Thank you, everyone.
Thanks, everybody.
Thank you.
Recording stopped.